Hi, I'm Dr. Nemechek, and welcome to the Nemechek Navigator. I want to talk about starting the protocol because there's a lot of chatter out there in social media that it's just sheer chaos and to bank on it. Well, I want to tell you that's not always true. Actually, I think that's often in my experience, that's often the exception, great exception to really what happens. Now, the premise behind the protocol is that we have bacterial overgrowth. So we have bacteria from the colon living in the small intestine, or as I put it, you've got fish living up with the birds, okay? And in autism, there's growing evidence that these bacteria are producing what you might call psychogenic chemicals. The one I talk about a lot is propionic acid. I won't be surprised if in a number of years we find there could be a variety of different chemicals being made, but they all alter the kind of cognition and awareness in the child. And so as you balance the intestinal tract and that balances, you lift this suppressive effect. It's kind of like a sedative, like Valium or something that's taken away. And so when you start the protocol, you have fish oil and olive oil. Those rarely ever cause any problems. And then you add the inulin typically, or the rifaximin if you're starting with that, maybe in an older or more severe child, as I discussed in another video. And these chemicals will be reduced, and it's as if you take your child off a potent sedative, and you have what we call the awakening. They're more alert, they're better eye contact, they can seem to respond better. Many parents say they are very present, like they are aware what's going on in the room. They're tracking people now for the first time ever. And so it's often a whole host of very, very positive things. Sometimes you start getting a little speech. You can get a lot of affection that wasn't there before. It's very positive. Now, there are a subset of kids who, due to their underlying neurological imbalances and developmental delay and some injuries and things like that, they might be more aware, have better eye contact, a better just comprehension, but they could also maybe have like a little insomnia. They're a little more agitated. They might be a little more aggressive, pinching a little or doing, some things like that. But you always have the good stuff with it, okay? And if you have your dosing in the range that we discuss and your inulin or your rifaximin in the dose ranges that we've been discussing, you may have this heightened effect of some negative features. But typically within a few weeks to maybe 2 months, if you have really an older kid, late teens or something like that, it might take a little longer to see that start coming down. You'll see it start coming down. And parents will say, oh yeah, the first, when you do have this kind of heightened awareness, parents will say, oh, the first few weeks were like, a little crazy. But then we're like, oh, he's getting better. We got this. We can handle this. Okay? It's really not chaos. Don't hesitate to use the protocol, okay, because of that. But you just got to get through that. Now, some children have bacterial overgrowth and they don't make propionic acid. This gets a little confusing. So you won't get an awakening. Now, these are kids who already have really good eye contact and awareness and comprehension, and they're following and stuff. So don't think the lack of that awakening means it didn't work, okay? You just have to wait a couple months to start seeing the gains to make that determination. We'll have a video on how to tell if the protocol's working in that respect that you could watch. Now, some of the parents have done this thing called a modified Nemechek protocol, which I've never started anybody on the modified protocol, but basically they give fish oil and olive oil first for a month or two, and then they add the inulin or rifaximin in hopes that it might dampen any kind of, negative behaviors if they were to even occur. You could try that. I think it's harmless, but I've never done it, and I really don't see any need for it. But, I don't care, because if you delay the inulin for a couple of months, you'll still be on the inulin. So I just want to get the kids started and get them recovering. So anyhow, I hope that's helpful. And that's all for now. I hope you find the other features in the Nemechek Navigator helpful. It's designed with you in mind to help answer all your questions and help your child recover as fast as possible. So take care. This is Dr. Nemechek. Bye-bye.